Hello, everyone. My name is Mohammed, and I'm a PhD candidate at the IUE department. And I'm so happy to talk about my research and background and explain what kind of research you can do when you are pursuing this major. So before everything, a little bit about my background. Before coming to the University of Michigan, I got a bachelor and master's in industrial engineering. And then after joining the University of Michigan, I started a PhD in industrial and operations engineering. And at the same time, I started a dual master's in statistics. And this is one option that all of you can have when you start coming to the University of Michigan. I've been fortunate to be advised by Dr. Mark Minoyan, and my research area in general is about real-time learning and optimization in healthcare. So what I plan to do here is that I'm going to generally talk about this research area at first, and then I talk about like two of my research works that I have done so far briefly, and then after that I will conclude my talk. So some of you might know about this offline decision-making process. So in the offline decision-making process, at first, we want to solve a real-world problem. And then for that, we have access to some data. So what we usually do is this. We use the data, and then using this data, we build the model. And this model can be a prediction model, an optimization model, or a combination of these two. And then this model should be able to help us to make a decision to solve that real-world problem. So it turns out that there's another decision-making process that people call it real-time or online decision-making. And in the online decision-making, we sort of have the same thing at first. So we have access to the data, and then we use the data to build the model, and the model will help us to make a decision. But here's the difference. Here, when we want to make a decision, we are able to see the feedback. And this feedback is basically the consequence of our decision or the consequence of the actions that we have made. So this feedback basically provides a data or some new information that can be added to our current data set. And then this current data set becomes larger when we have more interactions or when we are making more decisions. And then each time that we have a better data, we hopefully can build a better model, and hopefully we can build better decisions. So here we have this interesting phenomena that the data affects our decision for sure, because data help us to build a better model. And then even our decisions that we make today generates data for future. So we have this loop here. So because of this setting that we have in the real-time decision-making, here we are not just looking to make the best decision at each step. Basically, what we really want to do is that we want to make decisions that are good. At the same time, it can provide useful information that can be added to our data set. And then this hopefully can help us to make better decisions in future. So let me give you some examples here. I bet some of you have worked with the Netflix application, and you have seen that the application recommends some movies to you. Let me define a problem here. So here the aim, let's say the aim is to recommend a movie that aligns with your interests. And then in this application, the decision is that the application should make is what kind of movie it should recommend to you. And here the feedback is whether you have clicked on that recommended movie or not. Or another way of, for example, defining the feedback is that whether you have watched the recommended movie for at least 10 minutes or not. So here the Netflix at first doesn't have, if you're a new user, doesn't have a lot of information about you, but it starts from somewhere. It starts from some like limited knowledge or information it has from you. And it starts to recommend you some movie. And then after having a couple of interactions with you, it can gain more information about you. And then in a very short time, the application is able to recommend you some movies that are aligned with your interests. And because they are aligned with your interests, there's a really good chance that you click on it. And that's the whole aim of this problem. And basically the aim is achieved. So it turns out that these sort of real-time decision-making process can also be applied to the healthcare applications. Let me give you a very simple example here. For example, for some disease, a doctor has to prescribe a treatment for the patient. And usually there are a couple of treatments, so the doctor has some options. For example, the doctor has to pick between medication A or medication B. So at first, when the doctors visit, when a patient is visiting a doctor, the doctor doesn't have usually a lot of information about that patient. But there are a lot of algorithms that can help the doctor to be able to prescribe a personalized treatment that works best for this patient. So here, let me tell you what is the action, what is the feedback. So the action is that what kind of medication should be prescribed to the patient, and the feedback can be the patient health outcome. And this health outcome can be defined in a variety of ways. For example, we can define it as the mortality risk of patient that we want to minimize. Or another way is to define it as the risk of readmission of the patient in some cases, or risk of the patient or the disease progression for the patient. So all I'm trying to say is that this real-time decision-making has also a lot of application in the healthcare setting. And this is the main focus of my research area. So far, I'm designing real-time algorithms, and in my during my PhD, I have worked on a couple of healthcare problems. So I've worked on hospital admission control, on appointment scheduling, and also on some medical decision-making problems, for example, type 2 diabetes control and glaucoma disease control. And during these projects, I've been collaborating with different hospitals and clinicians and physicians. For example, I have worked with Trinity Health System, Michigan Medicine, Massachusetts General Hospital, and Calaway Center. So just to save some time, I'm gonna briefly talk about the first two projects here, and then I will finish my talk. So the first problem that I have worked on is related to patients' bed placement. So in a hospital, we usually have different types of beds in different care units. For example, we have general ward, we have a step-down unit, and we have intensive care unit. And these care units and the beds that are in these care units, they are usually different based on the levels of care provided to the patients. And as you may know, ICU or intensive care unit usually has the highest ratio of nurse to patient, and it usually provides the highest level of care to the patients. And then after that, for example, it follows by step-down units and general ward. And this is a typical settings in many of the hospitals. So the research shows that there's a relation between a patient health outcome and the bed placement. It means that if we assign a patient to different care unit or to different bed, the outcome or the patient health outcome would be different. So the choice of hospital bed for some patient is it matters, and it is also a challenging task because of a variety of reasons. For example, because of uncertain needs of patients, and also the limited beds that we have in the hospitals. So one thing that I want to highlight here is that you might say, okay, we already know that the ICU provides the highest level of care to the patients, so why not we always assign the patient to the ICU? And I would say the obvious answer is we have a limited number of beds here. So if we keep exhausting this option, meaning that if we keep assigning patients to the ICU, in a very short period of time, we might not have enough ICU beds anymore in the hospital. And the bad consequence of that is if we have a severe patient in the future, we cannot assign the patient to the ICU. So we have to assign the patient to a lower level of care unit or lower level bed, and this might have a very bad result for that patient. So here, the research aim is to build a real-time algorithm to help doctors with this bed placement task, and the aim is to improve patient health outcome based on the way that we define it. For example, we want to minimize the mortality risk of patients in a finite horizon. And then here, again, I just want to highlight that sometimes we have limited information. So we don't know everything about the patient. We don't know, for example, the risk of mortality risk for any type of patient. So the more when we interact with the patient, we can get more information. Basically, we can have a larger data set. We can build a better model with that, and then hopefully we can make better decisions. So that's why these algorithms can work in this area. And again, I already talked about that. We have limited bit in this problem. So if you want to compare this problem with the Netflix problem, I would say it's a more complicated problem, because here not only we have to choose the best actions, not only we have to choose the best type of bed for patient, we also have to be careful that we have limited resources in this problem, or we have limited beds in this problem. So basically we have to make a balance between making the best actions and using the resources. So the second problem that I have worked on is related to patient scheduling. In the patient scheduling problem in general, usually a patient requests for an appointment, and then the patient should be assigned to a physician and an appointment date. So the research shows that the quality of patient-physician matching and minimizing the waiting time can actually improve two things. It can improve health outcomes, and it can also improve the patient satisfactions. So recently, we have seen that there are some websites and applications to help patients to schedule an appointment. And the emergence of these applications and websites provide the opportunity to design some algorithm that can be used as a core by these applications and websites. And these sort of algorithms can provide a lot of good things. For example, they can pair patient with their best match available conditions. They can offer appointment based on the patient preferences. So we are basically doing a personalized appointment scheduling. They can align wait time of the patient with their urgency level. And they can also balance the resource utilization, which are the availability of providers that we have in a clinic, patient experience, health outcomes, and patient satisfaction, and a lot of other factors that we might want to take into account. So lastly, I thought that you might be curious to know, what do I like about the program the most? And if someone would ask me this question, and if I had just like 3 options or three things that I can mention, I would say I really like that we solve real world problems here. And it means that during your PhD, when you're working on different problems, so you pick the real world problem. So for that, you have to collaborate with different industries, hospitals, and clinics. And then when you're working on these real world problems, you really feel good, and you see that your research has some impact, and you're not just doing some things that you cannot see the effect of that. So it's a really good feeling that at least for me, I like it the most. So the second thing is that here we care about was modeling and theory at the same time. So because we want to solve the real world problem, we always pick a problem, then we start with modeling the problem, and then we come up with an optimization, prediction, or any type of tools that we can use to solve this problem. And at the same time, we want to have some performance guarantee for the method that we have designed. For example, we want to say, regardless of the data that we have, or method or algorithm, have at least this performance. And this is something that we can do in theory. And this is somewhere that we're going to use a lot of math. And the last thing here is that we have a lot of flexibility in this program. So basically, you can have as much math as you want. So based on your interest and based on the problems that you have picked, you can focus more on the empirical side, or you can focus more on the theory side, or you can actually strike a balance between these two. So all I'm trying to say is that we have a lot of flexibility here. Is that that's a really good thing that I like about this program. And at the end, thank you so much for listening, and go Blue.